Hi, this is Dr. GPV SUBBAIAH, spine surgeon, Care Hospitals, Hyderabad. So, low back pain is a very common problem, and most of the patients often ignore their low back pain. And we are going to discuss some of the symptoms. If you have any of these symptoms, you should see the doctor immediately. So, these symptoms are called red flags. Say, for example, if the patient has low back pain, and if this low back pain is radiating down into the legs, the so-called sciatica, associated with some tingling sensation, burning or numbness in the legs, so that's a sign that there could be some compression on the nerves coming to the leg. So if you have back pain and radiating pain associated with tingling sensation, burning or numbness, you should see the doctor immediately. So this is a sign of compression on the nerves. This is one red flag. The second red flag is sometimes the low back pain is associated with fever, loss of weight and loss of appetite. So if any of these complaints are present, say for example low back pain is associated with fever, that could be a sign that the patient might be having some infection in the spine. Sometimes loss of weight and loss of appetite could be signs of some form of cancer in the spine, or it could be because of some tuberculous infection in the spine. So if the low back pain is associated with tingling sensation, burning sensation or numbness in the legs, and with fever, loss of weight and loss of appetite, so that's a sign of either infection or some cancer in the spine. So some patients have back pain associated with loss of control over urine, motion, and sometimes they have difficulty in walking as well. So that's again a sign of compression on the nerves. So if any of these complaints are present, the low back pain associated with radiating pain, associated with fever, associated with loss of weight, loss of appetite, or associated with bowel disturbances or bladder disturbances, you should see the doctor immediately. And again, age is an important factor. A low back pain in elderly above the age of 55 years, you should not ignore. You should see the doctor straight away. Or if the low back pain is present in younger individuals, less than 18 years of age, you should see the doctor immediately. So age is also an important factor. Below 18 years or above 55 years, you should see the doctor immediately. Low back pain following even a simple injury, you should see the doctor. Even a trivial fall at home, like slip in the bathroom, that also can cause fractures of the spine. And following an injury, low back pain, you should see the doctor immediately. So these are some of the red flags, what we call. So if any of these things are present, you should see the doctor straight away. Otherwise, what can happen is you ignore the problem can become worse, and it might ultimately lead to some surgical intervention. If the problem is identified at an early stage, there is a scope for medical treatment. So that is the reason, never ignore your back pain and never ignore your red flags.